Medicaid is America's largest single provider of health care coverage, serving low income adults and children and people with disabilities. In the early days of the pandemic, Congress temporarily blocked states from kicking people off Medicaid, even if they were no longer eligible. As a result, enrollment reached unprecedented numbers. But that's ended, and now states have until next year to go back to pre-pandemic rules, check if those on Medicaid are still eligible, and remove those who aren't. Ali Rogan recently traveled to Arkansas, which is nearing the end of that process, which is known as unwinding.
Howdy.
Hi.
For Jennifer Rose and her wife Melanie, reading tarot cards is a way to spend time together and make some money.
It looks like there are some career possibilities that you might be thinking about.
The couple regularly does readings around Fayetteville, Arkansas, which they've called home for 3 years. That's on top of Melanie's work as a massage therapist and astrology writer.
And there you are, the Queen of Wands.
They've been on Medicaid since November 2020, both because of their combined income and Jennifer's disability brought on by rheumatoid arthritis and a rare immune deficiency.
I have 2 infusions each month. Those are absolutely life-saving medications that are very, very expensive.
The couple knew Arkansas's Medicaid program was changing with the expiration of pandemic-era protections, which meant people whose coverage had been extended past their eligibility would lose it. And even though Jennifer said their eligibility hadn't changed, months earlier they'd been asked to prove it by sending in some additional paperwork. Jennifer took no chances.
I went in person to the office and made sure that it was turned in.
When they hadn't heard anything a few weeks later, Jennifer went back to her local Department of Human Services.
I was told by the person at the front desk that I was denied, that my application had been denied. I didn't even get a chance to, submit other paperwork or have a conversation with the caseworker. Like, I'm completely and utterly confused.
More than 230,000 Medicaid recipients in Arkansas have lost coverage since April. About a quarter of them would have lost coverage anyway because they now earn too much money or asked to be removed. But most were terminated for procedural reasons, like failure to return renewal forms.
We're very concerned when we see those numbers.
Jennifer Wagner is a Medicaid eligibility and enrollment expert with the Center on Budget and Policy Priorities. So far, 34 states have publicly reported their unwinding data. Of those states, Arkansas has one of the highest rates of ending Medicaid coverage because of paperwork issues.
Their rate of termination, their low rate of renewal, is kind of out of whack with what we're seeing in other states, which is very concerning.
The Centers for Medicare and Medicaid Services recently warned Arkansas that its high paperwork termination rate might mean people are having trouble understanding and submitting Medicaid renewal forms and needlessly losing coverage as a result. And while Arkansas's termination rates seem high, Wagner says many states are having problems processing 3 years' worth of Medicaid renewals. In fact, the Centers for Medicare and Medicaid warned that over half the states in the country are kicking people off at too high a rate, and that all 50 states may be kicking children off disproportionately.
We're seeing metrics that we've never seen before, but we actually don't have a baseline. This has not been measured and reported on before.
In response to PBS News Weekend, a spokesman for Arkansas's Department of Human Services said there were large numbers of beneficiaries who would have been disenrolled were it not for the pandemic-era requirement, and that it is not surprising that this group would be disenrolled at a high rate now. Experts have also noted that some people who were terminated for paperwork reasons may have also been otherwise ineligible.
Mark your calendar to be on the lookout for your renewal timeframe.
Just north of Fayetteville, Melissa McManus is an attorney with Legal Aid of Arkansas, which provides free services to low-income people. She helped Jennifer Rose with her case.
People are coming to us because they've been terminated, and the people are eligible.
Each Friday, Legal Aid runs a help desk for Medicaid recipients at the local courthouse. Some clients are getting requests to submit extra documents when they should be renewed automatically.
It's cumbersome upon these individuals to try and gather information that is outdated, that they may not have real access to.
The process has been particularly stressful for Arkansans originally from the Marshall Islands. The Marshallese community in northwest Arkansas is one of the nation's largest, with more than 15,000 people. Because of a unique immigration agreement with the U.S., Marshallese people couldn't get on Medicaid until 2020. Now they're having to re-enroll for the first time, and many have limited proficiency in English. The state provides translations, but some say they still can't understand the forms.
The people that translate here are not from here. They're outside, and they're not Marshallese.
Carl Misgeri is with the not-for-profit Marshallese Educational Initiative. She spends most of her time these days helping her community navigate their Medicaid status.
The first time they sent out the flyer, I couldn't understand what they were saying.
How does that make you feel?
I feel like we took a step forward and then we took a lot of steps backward.
Arkansas's Department of Human Services said it began outreach to the Marshallese and other communities more than a year before the unwinding began.
Promotes integrity in the welfare programs.
The federal government is giving states up to 1 year to complete the Medicaid unwinding process, but in 2021, the Arkansas legislature passed a law cutting that back to 6 months.
There is an indication that they are going faster than they need to.
Wagner says the shortened time frame could lead to unintended consequences.
If there's a huge spike in application volume the next month or two, that suggests that a lot of people were in fact eligible and erroneously lost coverage.
A 6-month period is better than a year-long period.
Arkansas State Representative Aaron Pilkington voted for the shortened time frame.
The longer we allow people to remain on these rolls who do not qualify, who do not need it, that's taking money out of the hands of those who are truly needy.
Many people who are having trouble re-enrolling have been told simply to reapply for Medicaid, and that is going to add its own backlog.
It's a fair criticism. I would argue, though, if you're doing what you need to do, if for some reason you are accidentally kicked off, it's nice to know that there is a way to get back on. If you were worried about your coverage, we had made notices, we had done, try to let people know about it.
Some of the public awareness efforts don't reach Arkansans living in rural areas. Many of them are low income and change addresses frequently or don't have steady access to the internet. Oftentimes, their first chance to adjust their Medicaid status is through their provider.
Clinics like Boston Mountain Rural Health play a critical role in ensuring those patients keep their coverage. Sadie Davis helps patients navigate their Medicaid status.
There's a lack of knowledge in a lot of our patients about how to go about a lot of these things. They're getting information in the mail that maybe they don't understand.
Boston Mountain has offered patients help with insurance for several years, but they've had to hire even more staff to help with the unwinding. Beth Harris runs clinical operations here.
We're constantly expanding that program as the need continues to arise. I do expect it to increase just based off of what we've seen previously in the past.
Back in Fayetteville, Jennifer Rose got back on Medicaid about as quickly as she got kicked off.
I really just picked up the phone and they said, we had made a mistake and your Medicaid is fine. And I said, okay, thank you. And they hung up. That was it.
And you got that notice in writing.
But she says she was only able to sort things out with the help of legal aid and Melissa McManus.
I love my job. I love helping people, but it would give me great pleasure if they didn't need me. You shouldn't need a lawyer to be able to keep your health insurance.
Until then, she'll be at the courthouse every Friday to help. For PBS News Weekend, I'm Allie Rogan in Fayetteville, Arkansas.